Hello guys, and welcome to this tutorial showing without any cuts all the steps for a definitive cementation of a single crown, okay? So this is the materials that we are going to use. You are seeing that we are going to use a primer and a bond material, and then the definitive lute material or cement, which is this one, right? So this is the Permaflow DC, and that's the color A2, so from Ultradent, and let's start the procedure now. So we are going to start by using the primer, which is self-etch. So we don't need to do an individual etching procedure here. And to be self-etch, we need first to push this outer piston into the inner piston to activate the primer, okay? Like this, take a look. Now it's activated, and that's very important. We adapt the tip, so this tip you can actually use to apply the material. We need to apply this material for 20 seconds. But don't forget that you should not scrub the enamel, okay? So you are now applying on the dentin on your preparation. That's just a plastic preparation, a prefabricated preparation for training. And then let's see how to do that. So you are applying now the primer, and then after applying for 20 seconds, you are going now to dry for 3 seconds, okay? So you thin dry for 3 seconds, you will need to air dry, and then you should not rinse. Of course, you guys know that this tooth should be rinsed and dried before starting any procedures that we are showing now. And then you can even isolate the tooth with the rubber dab, okay? So now we are going to apply the bond, because now it's already dry, the primer, and then that's the bond material, the universal bond. We are using this one as well from Ultradent. And then let's see the procedure. So we now applying with this micro brush, and then we need to apply the bond for 10 seconds, okay? So we are going to apply throughout the entire surface, and then you scrub the surface of your preparation. And then we are going to, after this, to thin dry as well, okay? So now take a look at the shining appearance of the preparation, which is exactly what you want. Now, don't forget that you need to air dry significantly here. And now you are ready to do your light curing procedure, okay? So that's the Valo-X from Ultradent, a very good lighting curing device. We are going to talk about this device very soon. And don't forget that we also need to prepare the surface of our crown, okay? So take a look at these protocols here. So if it's metal based, then you are going to proceed with microabrade and sandblasting, followed by phosphoric acid. If it's porcelain, then hydrofluoric acid. After this, you have the phosphoric acid and then the silane, for example. So those are described protocols. And then for zirconia, you have the air abrasion and then the zirconia primer. So those are described protocols for you to have good results. And then we need to proceed with the cementation, okay? So now we are going to lute this crown using the Permaflow, the cement. We adapt the tip like this. You can discard a little bit of material just to make sure that everything is fine. And now we are going to apply the material throughout the surface, the intaglio surface of the crown, okay? So up to the borders, because you want to ensure, so take a look at this, now making sure that up to the borders it's filled with the material, because we want to make sure that there will be overflow of cement. Now we need constant pressure, of course, we already talked about this in the previous video. Some articles say for 3 minutes, it depends on the protocol. And here, ideally, we should have overflow of cement throughout the entire surface. It doesn't happen here because this is a plastic preparation and a plastic tooth for training, and that's why the preparation shape is not ideal. We should fix the preparation and even the crown design. So now to remove the excess, you light cure for 2 seconds only. Take a look at this, very fast, and now the excess of cement will be harder a little bit, enough for you to remove with your instrument, okay? So that's a technique that we do here. Take a look at this. We are going now to do this on the lingual side. So always protect yourself against the blue light with this orange protection, and then you light cure for only 2 seconds in order to be able to remove the excess of cement. Otherwise, take a look at this, it's very soft, the material, so you cannot remove properly. So just very quickly, just doing a little bit of light curing, and now take a look at this, we can remove the excess nicely, okay? But don't forget that at some point you also need to floss to remove the interproximal contacts, okay? So for the moment we removed with the Explorer or any other instrument, and now flossing, okay? To remove the excess from the interproximal surfaces. Don't forget that you need to make sure that there is no cement within the area of the periodontal pockets. Here it's a plastic model, the mannequin, and of course the cement may also be going down to the pockets, to the plastic gingiva, because this is not the actual patient, okay? But of course we should avoid that in the clinical situation. Now you light cure, the Valo-X will be activated for 10 seconds usually, and you reactivate of course to increase the time of light curing throughout the entire surface of the crown. So now in the lingual side, on all the surfaces, you are going to do that, and take your time to make sure that you have the best results from this definitive cement material. And lastly, we are going to check the occlusion, of course. So you are going to check the occlusion, you can always polish, and see you guys on the next videos.